Welcome to my recovery. I decided to try to give this show a little bit more structure. I also decided I'm gonna start posting more videos every week. Try to get on timeline. Try to put my all on this because I've been dealing with obviously some mental issues of my own. So I've been trying to deal with those and this, and neither one of them is really working out the way I want them to. So I'm just gonna try to put in everything I have in this and hope that hope for the best. Today I want to go over the certain medications that I know for um, opioid withdrawal or opioid addiction, however you want to call it. Let's see. How do I want to explain this? The A lot of people think that they don't do the medicine because they think that it's just trading one for the other, and I understand that thinking. I do. I do. I understand it. Of course, when it boils down to it, which one would you rather be addicted to? Would you rather be addicted to a suboxone or methadone, subutex, something like that? Of course, vivitrol, it ain't addictive. But would you rather be addicted to that and taking your medicine completely right from a doctor, prescribed, in the program, seeing the therapist, doing everything you're supposed to be doing? And would you rather be doing that and keeping with your recovery, not doing any more opioids, not needing them anymore, and or would you rather continue to, use fentanyl with every time using it with the possibility of OD and dying? So it's really just that simple. I mean, it's there's really no people who say that it's trading one for the other. They're just not ready to quit opiates yet. They just don't want to quit. That's just the truth of the matter is. And because when I started on suboxone, and I've tried vivitrol, and I know people that's on methadone as well. They go to the clinic and take methadone. So those are the ones we're going to be talking about today. And those ones they're good. I mean, there's really no reason to not try them at all. If you're on state Medicaid, it pays for it. You just have to make sure that you're clean when you go see a doctor. And you have to do 2 therapies a month, individual and 2 group a month, in order to get suboxone wrote to you. You get 2 strips a day. This is what a suboxone looks like right here. I don't know if you can see it or not. You see it? You see it? Right. Okay. And you open this. It's all it is a strip. It's like a Listerine strip inside it. I'm not going to open this up, but it's like a Listerine strip inside it. You place it underneath your tongue until it dissolves. After it dissolves, you take what it says on this. Most people don't do it, but you take a glass of water, switch it around your mouth, try to get the rest of the little particles, because this thing, like it's a strip, so it doesn't melt all the same at the same time. And trust me when I say you do not want to swallow this strip. You definitely want to have it melted in your mouth. You don't want it any other way to go down other than melting in your mouth, because it will make you sick. It's super strong orange tasting. It's hard for people to get past the orange taste. Matter of fact, a lot of people abuse this drug. They shoot it. They shoot it up. Or I've seen people even snort it because you get the pill kind as well, which they also dissolve underneath your tongue. But they're all super orange. I'm not gonna lie, it's the worst orange you've ever tasted in your life. But I mean, it's the price you have to pay for staying clean, right? I mean, it's a very small price to pay. It's been bad tasting medicine, right? That's nothing. A lot of people won't even need a whole strip. I'm not going to suggest that you cut up a strip, but I will say that, I mean, I have done it. I know people that do it, and they do it all the time. And like, I've had my doctor myself even tells me, because I get, when I got wrote one of these, I get wrote them 2 strips a day, and tell me to cut them in half. They tell me to cut them in half and take them 4 times a day, basically. Take one when you wake up, one, throughout the day, another one throughout the day, and then one before bed. I don't do that because I don't really feel I need that much. That's how strong this medicine is. I mean, and you don't really need that much. This medicine has both saved my life and it actually ended my life once. So you have to be on your on your tee with it. You have to be good with it. You can't take Xanax or Klonopin like my dumb butt did, and that's the reason why I died. So it was because I was on this, took a bunch of Klonopins trying to get to sleep because I was up 3 days smoking crack and tried to get some sleep. So I snorted a bunch of Klonopins and took a bunch of Klonopins, and next thing I know, I was waking up with paramedics over top of me, telling me that I was non-responsive for a while and that I was dead. So, which there's some things that happen in between there, but that's the gist of it. And so do not do that on any of these drugs. Don't do that on any of these. Don't do it on vivitrol. Don't do it on any of these because it can have an adverse reaction. This stuff affects your breathing, and so does those drugs. And any drug that affects your breathing, you don't want to combine with this drug because it will stop your breathing. It literally will stop you from breathing. So and you'll die. So yeah, you want to make sure that's that. If you're pregnant or nursing or something to do with that, they for women they will give you what's called subutex. Okay, it is the same thing as suboxone except without the naloxone in it. And me personally, I think it's stronger. It doesn't have the opiate blocker in it, but whenever I've done it, it's always seemed like it's been way stronger for some reason. I don't know why, but it's the same milligrams as the Suboxone, but it's just way stronger for some reason to me. Well, the reason why I want to talk about this is because a lot of people they don't believe me when I say that when you're on opiates, you're not yourself. You don't you're not thinking right. You don't think straight at all. You're not thinking anywhere near like you should be thinking in real life. And the reason why I know this is from this medicine because um, just go through withdrawal one day. Go about 24 hours without doing your fentanyl or your heroin or whatever, and take a piece of this, and tell me if your thinking doesn't change from the moment you're in withdrawal to the moment you're after when you take this medicine. Tell me if your thinking doesn't. I mean, it will completely change. You won't even be thinking about opiates anymore. As soon as you take this medicine, you'll be like, wow, I feel really good. This is crazy. I don't ever feel this good. And like, you won't even think about opiates for the rest of the day. For the rest of the day, it's unbelievable. It's a life saving medicine. It really is. And I can't, promote it enough. Just, don't abuse it. Don't shoot it up because like I said, it's a strip that dissolves. It doesn't just dissolve good in water. A lot of people think that they can shoot this up without a filter, which is really stupid to shoot anything up, period. But even without a filter, it's even worse. So, like, they end up having to have heart surgery. I know several of my friends have had to have heart surgery just because of shooting up these boxes. And you don't need to. You don't need to. And in all honesty, taking it underneath your tongue, taking it the right way, it lasts a little bit longer taking it underneath your tongue than it does to shoot it up. So there's really no reason to even shoot it up at all. But I know we're all addicts, and that's just the way we get used to doing stuff. Because I've shot this up for years, for a decade or more. So I mean, I know exactly. But I always use a filter. I've never not used a filter shooting up something. So Vivitrol is the same thing as Suboxone, but it doesn't have the buprenorphine in it. It's just a naloxone, and it's a shot that lasts 28 days. I have tried it. It's good. It's just like this, and you don't have to wake up, take it every day, like regular medicine. But my problem with it is that once you go on that last about 5 days before your next shot, you could tell the difference. You can tell like it was starting to wane. You can tell like it was starting to wane. So your symptoms, your withdrawal, not it's well, your withdrawals wouldn't come back, but your bad thinking habits would start to come back about 5 days. For me, would come back about 5 days. So I didn't like it that well because of that. I felt like there was a bigger risk of me trying to beat it, trying to beat it out. And methadone is something that you would have to go to a clinic to get. Your insurance pays for it. It's a liquid that you just swallow. They'll give it to you every day. And then once you're there for a while, they might give you some take homes. It is, it's good. It does work. It's definitely better than fentanyl. I'm not necessarily a fan of it, but people talk the world of it. I'm not going to, speak anything bad about it. I just know that it's definitely highly addictive, and the detox is pretty bad off of it. But hopefully you will never have to worry about that as long as you're going to the clinic and getting it. Anyways, let's see. There's something else I was going to say, and I forgot what it was. The reason why, like, I'm bringing this medicine up is when I was in opiates, they were just so expensive, man. I mean, like, you either had to rip somebody off, or you had to hit a lick, or you had to do something in order to get the money. And I tried to work. I worked for almost every dime I got. I tried to work and get my money, and I had to feed me and my wife and both of our addictions. And it was, I was working a regular job, coming home, doing odd jobs, and never being home at all, never seeing my family, just to fill our habits. It was that tough money wise, because we were spending $40 a drop for each. For me, $40 for her, just to feel normal. And then we were spending another 40 or more on there on top of that, just to get to the point where we was trying to get. The first time I tried this medicine, first of all, I realized that my thinking was completely screwed over on opiates. But the second thing I realized is that this stuff is so much easier to get. It's so much cheaper. Even if you bought it off the street, it's so much cheaper. It lasts so much longer. And you get almost the same feeling from it. I mean, you do hit a ceiling, you do get a ceiling effect, which means that, you know, for me, when I take these, if I take one, like if I take one now, if I try to take another one on top of it, like if I don't take it instantly with it, if I take it less than within the 12 hours period afterwards, like I don't feel that second one at all. After about 12 hours or so, I'll feel the second one. I can feel the difference when I take it. What you do, what it does is where it blocks all your receptors. It basically gives you a baseline feeling, okay, and the only way of getting past that is literally to try to beat it and OD off of opiates, which is stupid, or just get used to that baseline feeling. But that baseline feeling, when you first take this, it made me sick. I mean, it is so strong that that it floored me. It surprised me that I couldn't understand, which Steve Stone wasn't big at the time when I started taking these, that why nobody was taking them. I couldn't understand it. I could not understand it for the life of me. I was like, man, these things at the time, these things were like $20. They were the wafers. They were little tiny pills. When they first came out, they were $20. They, I was spending $50 to get the same, just to feel normal off of heroin at the time. And I could spend $20 on this. I could cut up the piece of box on it, or cut it up in the fours, and it would last me 4 days, and I'd get the same feeling I would got off of $50 of heroin. That's $200. Of heroin I would had to go through for 4 days for $20 worth of one of these. I mean, it was, for lack of a better word, it was a no-brainer. Like I was like, why would I ever touch heroin ever again? I mean, why would I? There's really no reason in it at all anymore. But you do get a ceiling effect. So, like, it's not going to hit. You're not going to hit you're not going to fall asleep and pass out on it and all this other stuff. You're not going to hit, balls into the walls, fucking, high. You're not going to get high. You're going to the first time you take it, it's gonna hit you. You're gonna feel it. You're gonna be like, man, this is crazy. The second time you take it, you're gonna be a lot more used to that feeling. The third time you take it, you're gonna be like, okay, well, I don't really feel that much anymore, but I still feel okay. And then it's gonna stay that way about until you start getting used to the medicine itself, and then you might have to go up or down, whatever, increase your dose or whatever. You have to talk to your doctor about that stuff. But I mean, like, so you get used to it really quick, and it does stay, and it does stay the same. But I mean, you're talking about not getting sick. You don't get sick. Um, as long as you have your suboxone or whatever, you don't get sick. You don't start detoxing. When I have detox of this stuff, it's nowhere near as bad as opiates. Not even close. I mean, and it usually it doesn't, like opiates, the next day you're sick. This stuff, like, it would hit me maybe day 3 to 5, somewhere around there. I would start then feeling bad. It would take that long for this stuff to start getting on my system where I'd start feeling bad. And but I would never get as bad as I did with opiates. Never felt that bad again. Um, Another thing I do want to say is, if you're on opiates and you do get a chance to you do one of these or whatever, do not do these while you're on opiates. It will it'll push every bit of that opiates out of your system, and it will make you detox unbelievably bad. Unbelievably bad. It'll be the worst detox you've ever felt in your life. You will, hate God, hate the world. I mean, I'm telling you, it is extremely bad if you have opiates in your system when you take this. So make sure you're already in withdrawal before you take any of these, please, because if you do that and you got it, you probably won't ever take it again because it's that bad. It's that bad. You won't ever get another chance, and that's a lot of people's problem. Um, I can't talk good enough about the medicine. These medicines should be. Everybody should at least give them a try. I know there's people out there that can't stand them, and they do everything to do everything they can to stay away from them, and they make up every excuse in the world to not be on them. And I get that there's a percentage of people out there that they just don't work for them. I understand that. I do that. But there's so many different medicines now that I feel like if you really wanted to get clean, and that's really what it boils down to, if you really want to get clean and you can't do it cold turkey without anything, that there's going to be a medicine out there to help you somewhere. There will be a medicine out there to help you somewhere. I mean, I can almost guarantee you that. And so it's just you just have to stay focused, and they're going to put you on a regimen in order for your insurance to pay for it if you got state insurance anyways. And so you're going to have your therapy, good therapy. I'm not going to say anything that's great therapy or anything, because if it was, I wouldn't be doing this right here. But it's therapy. It's somebody to talk to, and really, it's just what a medicine is really why you're doing it. But anyways, so that's really what I want to talk to you today about, and I just want to make sure that you guys know that I'm going to start pumping out more videos. So, make sure you like, subscribe, all that crap. Make sure you hit the bell, because I'll be posting a lot more videos here within the next few weeks. Try to, at least double what I've been doing, or maybe even triple. Who knows? I don't know. I ain't figured that out yet, but I know I'm going to be doing more. So, but, thank you for watching.